Hi, my name is Dr. Rachel Brem. I'm a doctor and I'm a survivor. At the age of 37, I survived breast cancer. And last week, at the age of 61, I survived COVID-19. This is my story. Normally, I diagnose patients with breast cancer every day, and I've dedicated my life to saving theirs. But in the last 2 weeks, I found myself not being able to do any of that. My husband and I were the first two people in Baltimore County, Maryland, to be diagnosed with COVID-19. We have no idea where we got it, and unlike some people with minimal or no symptoms, that was not our experience. The muscle pain was difficult, even getting in the shower hurt. Often I was short of breath, I had a fever much of the time, and although I've had flu before, surgery before, and chemotherapy, I've never experienced anything quite like this. Fortunately for us, we were not hospitalized and we convalesced at home, and both of us are doing well. I can't imagine being isolated in a hospital, not being surrounded by friends and those that love you. And my heart goes out to everyone who is in that situation right now. My life has been devoted to and dedicated to beating breast cancer, not COVID-19. But after having lived through both, there are some similar lessons that are worth talking about. Breast cancer is scary. If you have gone through it, if you know anyone that has, you know how terrifying it can be. This is also true of COVID-19. I know many of you are out there are afraid. And instead of telling you not to be scared, I want you to harness that fear to a good aim. I'm here to tell you that fear is going to help you take control. The best way to beat COVID-19 is not to get it and not to spread it. Our greatest tool is prevention. We have to do things before they feel necessary in order to win. Practicing social distancing will save lives. The same is true for breast cancer. The best way to beat it is through early detection. It may feel unnecessary, but it will give you the best chance at beating breast cancer. Right now, COVID-19 is of paramount importance. Asymptomatic breast cancer screening will have to wait. And if you have a screening examination scheduled, reschedule that. And that's because the risk of exposure is so great at this time. Brave doctors are still seeing women with breast cancer symptoms. So what should you do? Be diligent about self-breast exam. Know yourself. And if you have a problem, even during this pandemic, call your doctor. But use good judgment. Don't call unless you feel it is needed, because seeing a doctor puts you and them at risk until this pandemic subsides. What should you do about COVID-19? You know, you've heard it. Stay in. Like breast cancer, the only way to beat this disease is to take control. Do the hard thing. When you're feeling great and invincible, stay in. Don't go to other people's homes. Don't see other people. Don't be within 6 feet of other people outside of those in your home, and wash your hands a lot. It's worth it. Keep yourself and others healthy by finding ways to be home. But please, please take the approach of early detection. Channel your fear. Then, because of your actions, we look forward to celebrating together in health and in person. Thank you for listening to my story, and thank you for taking care of yourself and others. The Brem Foundation and I are here for you and with you. Please feel free to reach out. Thank you for your love and support. We need it more than ever.